Oncology Block for the 7th semester in medical faculty. The Oncology Block is part of the medical curriculum focusing on understanding cancer, from its etiology, pathophysiology, and diagnosis to clinical management. Given the increasing prevalence of cancer, this block is crucial in equipping students with the knowledge and skills to manage cancer patients effectively. Below is a detailed explanation of the Oncology Block. 1. Introduction. Overview of oncology. A definition of oncology. A branch of medicine that studies tumors or cancer, including diagnosis, treatment, and prevention. B. Cancer epidemiology. Cancer is one of the leading causes of death worldwide. Common cancers in Indonesia: breast cancer, cervical cancer, lung cancer, colorectal cancer, and liver cancer. C. Differences between benign and malignant tumors. Benign tumors, localized growths that do not invade other tissues. Malignant tumors, cancer, rapid, uncontrolled cell growth capable of spreading to other organs, metastasis. D. Learning objectives. Understanding cancer mechanisms. Learning multidisciplinary cancer diagnosis and treatment. Understanding palliative care and communication with cancer patients. 2. Cancer biology basics. A cancer mechanisms, genetic mutations, changes in proto-oncogenes, tumor suppressor genes, or DNA repair genes, uncontrolled growth signals, activation of proto-oncogenes into oncogenes, loss of apoptosis regulation, cancer cells evade programmed cell death, angiogenesis, formation of new blood vessels to support tumor growth, metastasis, spread of cancer cells through blood or lymph to other organs. B. Risk factors. Genetic. Inherited mutations like BRCA1, BRCA2 in breast cancer. Environmental. Exposure to carcinogens, e.g., cigarette smoke, radiation. Infections, HPV, cervical cancer, hepatitis B, C, liver cancer. Lifestyle, unhealthy diet, obesity, alcohol consumption. 3. Cancer classification. A based on tissue of origin, carcinoma, originates from epithelial cells, e.g., lung cancer, breast cancer. Sarcoma, originates from mesenchymal tissue, bone, muscle, fat. Leukemia, cancer of the blood or bone marrow. Lymphoma, cancer of the lymphatic system. B. Based on staging, stage 0. Cancer is confined to a specific cell layer. Stages I2. Localized tumor with or without nearby tissue invasion. Stage 3. Spread to lymph nodes. Stage 4. Cancer has metastasized. 4. Cancer diagnosis. A history taking and physical examination. Symptoms: weight loss, pain, lumps. Clinical examination, inspection and palpation of suspected areas. B. Diagnostic tests, imaging, ultrasound, CT scan, MRI, PET scan. Laboratory tests, tumor markers, AFP, liver cancer, CA-125, ovarian cancer. Biopsy, tissue sampling for histopathological examination. C. Staging and grading. Staging determines the extent of cancer spread. Grading assesses tumor cell differentiation, low grade versus high grade. 5. Cancer management, a main treatment modalities. 1. Surgery, surgical oncology, goal, remove primary tumors and affected tissues. Indication, early stage or localized tumors. 2. Chemotherapy, use of drugs to kill or inhibit cancer cell growth. Examples, doxorubicin, cisplatin, 5-fluorouracil. 3. Radiotherapy, use of radiation to destroy cancer cells. Side effects, damage to surrounding healthy tissue. 4. Targeted therapy, drugs targeting specific molecules like receptors or signaling pathways. Example, trastuzumab for HER2-positive breast cancer. 5. Immunotherapy, boosts the immune system to fight cancer. Example, pembrolizumab, PD-1 inhibitor. B. Advanced approaches. 1. Palliative care, focuses on improving the quality of life for advanced stage cancer patients. Includes pain management, nutrition, and psychosocial support. 2. Rehabilitation, restoring physical, psychological, and social function after cancer treatment. 6. Cancer prevention and early detection, a primary prevention. Public education on healthy lifestyles. Vaccination, HPV for cervical cancer, hepatitis B for liver cancer. Avoiding exposure to carcinogens. B. Secondary prevention, early detection through screening. Pap smear, cervical cancer. Mammography, breast cancer. Colonoscopy, colorectal cancer. C. Tertiary prevention, preventing recurrence through regular checkups and adjuvant therapy. 7. Practical training in the Oncology Block, a clinical simulations, fine needle aspiration biopsy, FNAB. Techniques for fluid cytology collection and interpretation. B. Case discussions, analyzing complex cancer cases with a multidisciplinary approach. C. Communication with cancer patients, delivering bad news, discussing prognosis and treatment options. 8. Ethics in oncology, a treatment decisions, respecting patients' choices regarding treatment, including palliative care. B. Cancer research, ethical considerations in clinical trials and experimental therapies. The Oncology Block prepares students to face complex challenges in diagnosing and managing cancer, both clinically and psychosocially.